Hello, welcome to our channel. In this video, we will talk about the third trimester of pregnancy, which lasts from week 28 to week 40. During the third trimester, your baby will gain a lot of weight and prepare for life outside the womb. You will also experience many physical and emotional changes as your body prepares for childbirth. If you are new here, don't forget to subscribe and press the bell icon so you never miss any update. Let's dive in. During the third trimester, your baby's brain will continue to grow and develop. The eyes can open and close. Your baby will begin to respond to light and sound. By the end of the third trimester, lanugo, which is a downy, soft body hair that helps your baby stay warm in the womb, will start to disappear. The skin will become smoother and softer. As your baby gets bigger, your healthcare team will monitor your baby's position, size, and growth at each checkup. Starting at around week 33, your baby's bones will harden, but the skull will remain soft to help your baby's head moldable during birth. Most babies will be positioned head down in your pelvis by the start of the third trimester. This allows the baby to fit through the birth canal more easily. Don't worry if your baby isn't in the right position, because most babies will turn into the ideal position for delivery by the time you go into labor. If not, your healthcare team may offer options such as external cephalic version, where they try to move your baby into the correct position from the outside. If this doesn't work, your baby may be delivered by a planned cesarean section. Here's what to expect with baby's development week by week. At week 28, your baby is getting longer by the week, possibly topping 16 inches, almost as big as your belly. Weight can double over the course of the last 12 weeks of pregnancy. Now that your baby's brain is fully formed, your little one will start responding to sounds, including your voice and even music. Your baby can now suck his or her thumb and will often do so when you feel the hiccups. Those are the times when your baby is sucking on the umbilical cord. At week 29, your baby's organs are maturing and becoming ready for life outside the womb. Your baby's hearing is also developing, and it will start reacting to different sounds. At week 30, your baby's bones are hardening. The fat under the skin is starting to form too, although the baby will still be mostly made up of water. At week 31, your baby's eyelids are finally opening and can react to bright light with a startle motion. At week 32, your baby's ears are fully developed, but they will stay soft until birth. Talk to your bump and sing songs to your baby, who's happily listening. At week 33, your baby's body is filling out and gaining weight. Your baby is getting ready to store fat and regulate body temperature after birth. At week 34, your baby's muscles are developing, and he or she will start practicing for those first few big yawns. At week 35, your baby is now full term, which means that if your baby were to be born today, he or she would have a good chance of surviving. At week 36, your baby's brain is sending signals to those fully developed muscles, and he or she will start moving around more. At week 37, your baby will be considered full term. At this stage, your baby's lungs are fully developed and capable of staying warm after birth. At week 38, your baby's body is storing up fat and preparing for life outside the womb. At week 39, your baby has dropped lower into your pelvis in preparation for birth. At week 40, your baby is almost ready to meet you. Now that your baby's body is mostly filled out, he or she will continue to put on fat in preparation for life outside the womb, and your baby's final weight will depend on how much fat he or she stores in those last few weeks before arrival. The main symptoms you will experience during the third trimester are related to your growing belly and your baby's growing size. Back pain, leg cramps, and swelling in the ankles, hands, and face are common. Your baby's growing uterus can also press against your diaphragm, making it harder to breathe. You may continue to experience heartburn and indigestion. Finding a comfortable sleeping position can become difficult as your belly grows. Sleeping on your side can improve blood flow to both you and your baby. Also, you may have to get up more frequently to use the bathroom. That's because your baby is putting pressure on your bladder, making it harder for you to hold your pee. So, it's important to drink plenty of water, but don't overdo it. Just drink enough to keep you and your baby hydrated. You may notice some changes in your skin during the third trimester, such as stretch marks, darkening of the skin on the face, called chloasma, or increased body hair. These changes are caused by hormonal changes during pregnancy. Throughout your third trimester, your healthcare team will monitor your and your baby's health at regular checkups. Until week 36, you'll see your healthcare provider every 2 weeks. After that, you'll have a weekly appointment until delivery. During these appointments, your provider will check your blood pressure and look for swelling. They'll also listen to your baby's heartbeat and feel your baby's position. If your baby is low in your pelvis, your provider may perform a vaginal exam to determine how far along you are and whether your cervix is beginning to thin or dilate. Around week 36, your provider will test for group B streptococcus, a type of bacteria that can cause an infection in newborns. If you have this bacteria, you'll need to receive antibiotics during labor to prevent your baby from getting sick. It's normal to have some discomfort and pain during the 3rd trimester. However, if you experience severe or persistent pain, don't hesitate to contact your provider. Some types of pain, especially severe pain in your abdomen or pelvis, could indicate a serious problem that needs attention. Your provider will also want to know about any vaginal discharge, bleeding, or other unusual symptoms you might be experiencing. False labor, also known as Braxton Hicks contractions, can occur during the 3rd trimester. These contractions are usually irregular and don't get stronger or closer together. They may feel like mild cramping or tightening in your abdomen. Braxton Hicks contractions help prepare your body for real labor and often become more frequent as your due date approaches. While most 3rd trimester symptoms can be managed with lifestyle changes and home remedies, there are some medical treatments that can provide relief. If you're struggling with severe heartburn or indigestion, your provider may prescribe an acid reflux medication. There are also medications that can help relieve nausea and vomiting during pregnancy. If you're looking for ways to find some relief during the 3rd trimester, there are several things you can try. Getting plenty of rest, eating a healthy diet, staying hydrated, and exercising regularly can all help make the 3rd trimester more comfortable. Walking, swimming, and prenatal yoga are great exercises during the 3rd trimester. Staying active can also help reduce swelling in your legs and feet. You can also try using a heating pad or taking a warm bath to relieve back pain. Now, let's discuss the signs of labor. It's crucial to understand when it's time to seek medical attention. The top 3 signs of labor are regular contractions, water breaking, and the loss of the mucus plug. Regular contractions are tightening and relaxing of the uterus that gets stronger and closer together. They can feel like menstrual cramps or a tightening in your abdomen. When your water breaks, you'll experience a gush or trickle of fluid from the vagina. The mucus plug, which is a thick mucus that seals the opening of the uterus, will come out as a single mass or in pieces. If you think you're in labor, contact your provider and head to the hospital. It's important to remember that early labor can last for hours, so don't panic if your contractions aren't regular or if you do not have any of the other signs of labor. The 3rd trimester is the final stage of your pregnancy journey, and it's an exciting time as you prepare for the arrival of your baby. While it can be challenging to manage the physical and emotional changes during this stage, there are ways to find relief and make the experience more enjoyable. We hope this information is helpful for you. If you have any questions, feel free to ask. We'd love to help. And don't forget to subscribe and press the bell icon so you never miss any updates. Thanks for watching. See you next time.